Hello everyone, this video is the continuation of our previous video, that is mood disorders introduction. In the previous video, we have learned what is mood and mood disorders and few terms of mood disorders and its classification. And in this video, we are going to learn some of the classification of mood disorders such as mania, depression and bipolar mood disorders. And for each topic, we are going to learn its definition and its classification, etiology, clinical features and symptoms, diagnostic tests, treatment modalities, and finally, nursing management and nursing diagnosis. This is Ricky and you are watching Nursing Gola. A manic episode is characterized by a sustained period of abnormally elevated or irritable mood, intense energy, racing thoughts, and other extreme and exaggerated behaviors. People can also experience psychosis, including hallucinations and delusions, which indicate a separation from reality. The classification of mania according to ICD-10 is given on the screen. And these are the etiological factors of manic episode. While norepinephrine metabolite levels are normal during mania, other neurotransmitters such as dopamine, acetylcholine, and serotonin have all been implicated in manic and hypomanic episodes as well as in the depressive symptoms that follow. The findings suggest that genetic transmission occurred by a sex-linked single or double dominant gene. Many practitioners see the dynamics of manic depressive illness as being linked through a single common pathway. They see the depression as the manifestation of losses. Therefore, the mania serves as a defense against the feeling of depression. Manic symptoms include irritability or euphoria along with symptoms such as decreased need for sleep, grandiose ideas, impulsive behavior, increased talkativeness, racing thoughts, flight of ideas, increased activity, and distractibility. These are the signs of manic episodes. The clinical features of mania includes elevated, expansive, or irritable mood. Again, there are 4 stages of elevated mood: euphoria, elation, exaltation, ecstasy. And these are the other features of mania. Pause the video if you want to take notes. There are few alternative terms for hypomania. They are under mania or less than mania. Hypomania is a mood state characterized by persistent disinhibition and mood elevation, with a behavior that is noticeably different from the person's typical behavior when in a non-depressed state. And these are the symptoms of hypomania. Diagnostic tests will be done according to the signs and symptoms. And we have the treatment modalities like pharmacotherapy, electroconvulsive therapy, and psychosocial treatment. And if you are looking for a nursing management for mania, I will play the slides with a preview of 5 seconds, which include assessment, diagnosis, and interventions. Depression. It is a mental health disorder characterized by persistent depressed mood or loss of interest in activities causing significant impairment in daily life. These are the common types of depressive disorders. And you can see the classification of depression according to ICD-10. Etiology of depression is mainly based on biological theories, neurochemical factors, genetic theories, endocrine theories, and circadian rhythm theories. There are few psychosocial theories which explains the phenomena of depression. Some of them are psychoanalytic theory, behavioral theory, cognitive theory, sociological theory. According to transactional model of stress adaptation, the depression occurs as a combination of predisposing factors such as past experience and existing conditions and inadequate coping skills, etc. In depression, the patient's sadness mainly depends on the retardation of thoughts and actions. These are the clinical features and some of the symptoms of depression. Some of them are depressed mood, depressive cognition, suicidal thoughts, psychomotor activity, psychotic features such as delusions and hallucinations. And some of the somatic symptoms of depression you can see on the slide. The diagnosis of depression is mainly based on ICD-10 criteria. Here are the treatment modalities of depression. We have psychopharmacology, which includes several drugs, and we have physical therapies and psychosocial treatments. And you can note down the nursing management from the slides. Bipolar affective disorder or manic depressive disorders. Bipolar disorder is a mental disorder that causes unusual shifts in mood, energy, activity levels, concentration, and ability to carry out day-to-day tasks. And this is the classification of bipolar affective disorder. These are the etiological factors of bipolar affective disorder. These are the symptoms of bipolar disorder according to highs and lows. The diagnosis of bipolar affective disorder can be done based on signs and symptoms of ICD-10 criteria, and the treatment includes some of the drugs shown on the screen. Prognosis. The average manic episode lasts for 3 to 4 months, while a depressive episode lasts for 4 to 9 months. We learned something about mania, depression, and bipolar mood disorders, and in the next video I'll come up with the topics which are left over under the classification of mood disorders. Thank you so much for watching this video. Subscribe the channel for more updates, and for more support click on the bell icon to get notification. Thank you.